And welcome back to Power Breakfast. This morning we are going to be talking about some innovations in the world of health and how it is that you can find out how you can be helped wherever it is that you are across the country. We have two apps that we're going to be talking about today and two representatives from the companies that have made them. So first of all, I want to welcome Norman Jewett, who is the marketing director of Livia, the app that you see here on the screen. Welcome to Power Breakfast.
Thank you.
And also Karan Christie, who's the MD of telemedicine. Thanks for being here. Yes, I'm going to start with just finding out a little bit about your professional backgrounds and how it is that you ended up in the companies, in your respective companies. We'll start with you, Norman.
Thank you, Joy. I am a biomedical scientist. I did a first degree in science, and then I went on to do an MBA. After I had worked in the pharmaceutical industry for about 6 years. So how I ended up in the technology world, the director, the founder of Pharmachem, is a very brilliant guy. And having worked in the medical industry, because he is a dental surgeon, he decided to expand his business, the pharma business, by adopting technology. So it's something he has worked on for about 2-3 years before we got to launch Livia only 2 weeks back.
Okay.
Yes.
All right. And Karan, how is it that you ended up at telemedicine?
So by profession I am an IT consultant, and it happened to be that I ended up in a company who was dealing with ERP solutions, and I landed on the healthcare vertical. And having a passion in healthcare, I saw how healthcare needs IT so that it can be boosted and uplifted. And because of that, I saw several solutions which were there, and telemedicine took my attention. So I took that up 4 years ago and wanted to venture into that and see how we can improve healthcare in Kenya and Africa as a continent, and be able to bring forth to the people who are living all across the areas.
Okay. So let's start by digging in and finding out exactly what it is that your respective apps do. So Livia, is this live, first of all? Is the app live? Are people able to download this and start its use right away as they're watching this?
Yes, actually we have over 3,000 users already. We did the launch 2 weeks back in Nairobi. That's after we had done a 6 weeks pilot in Mombasa.
Okay.
So we already have partners in a number of towns. We have partners in Kisumu. We have partners in Eldoret, then Malindi, Mombasa, and Nairobi.
Okay, tell us about the app.
Now Livia is a link between a patient and the pharmacy. Now say you want to buy something from the pharmacy and you're not even sure of where you would get it. You go to the app and you post your request. So what the app does is it picks your request and sends it out to the pharmacies in your vicinity.
Could you just go ahead and show us exactly how it works so we can know more about the interface here?
Yeah, so this is what you get as a user. You go to make an order. If you have a prescription from a doctor, you have the option of taking a photo of that prescription. Or if you have the photo saved in your gallery, you can get it. You can see from up here. Or you can search from a list of medicines. Even if the medicine you're looking for is new in the country and it's not even in any of the databases, you just type in the name. Let's take an example of a common medicine, like one called Zyto MR. It leads you to this page where you can choose the number of tablets you want to buy. You add to the cart, and you can add as many drugs as you need by just clicking on add drug down there. So for now, let's just use this. You go to request a price, and the app gives you the option to choose whether you want the drug delivered to you or you want to go and pick it from the pharmacy. So let's say we want to self-collect. And then the app will ask you if you want Livia to suggest chemists from where you can buy the drug, or if you have a preferred pharmacy. So let's choose a preferred pharmacy for this. So when you click on next, it picks your location. Now this is important so that the app will be able to know the pharmacies within your vicinity. Let's select the current location here. You can zoom and see the exact location of the pharmacies that are in your vicinity, and then you can go to list view and scroll down and pick on the pharmacy that you want to buy your medication from.
Okay, so if you choose the delivery option, how many days are we talking, or what's the duration of this drug being delivered to you?
Now remember, we said it's location based. So the pharmacies are within a radius of 7 kilometers currently, but we will reduce that to even 3 kilometers. So we're talking about delivery within less than 1 hour.
Okay.
Yes, delivery within less than 1 hour.
Okay.
Yes.
Interesting. I'll come back to you with some additional questions, but thanks for sharing that interface. It looks quite interesting. Karan, tell us about what your app does.
So telemedicine helps to bridge gap between a patient and a doctor. As you know, the doctor-patient ratio here is 1.8 to 10,000, whereas 1.8 are the doctors and 10,000 are the patient, which means we don't have sufficient doctors to be able to treat those number of patients. And most of the patients live in rural areas, almost 70 to 80%, who don't have access to even the primary health care. So this is where telemedicine comes in. It's able to bridge the gap between the patient and the doctor with the help of IT. So what we have designed and developed is a solution which can connect the patient wherever they are to the doctors. It might be a medical officer, it might be a specialist or a super specialist. So based on that, this is the kit which you're seeing here. These are all the medical devices. We have the fetal Doppler, we have the BP, we have the ECG, we have the thermometer, we have the urine analysis, sugar test. We can do all this multiple tests right here, and we can transfer the data from one end to the other end, and the doctor can be able to see the patient on an audio video mode, can be able to consult with the patient and diagnose the patient based on all the information he's been given from the other side. So just to give you a scenario, we have a kiosk in a rural area, or we have a primary facility. So we usually give them this kit along with the solution, which you can install it in a laptop or on a tab on a mobile phone. So assuming there is a nurse who captures the patient records, patient registration is done, vitals are taken, chief complaints are entered. From there, the nurse sends the patient to see a clinical officer, assuming. So the clinical officer would like to refer this patient because of some issue, maybe gynecology, it can be cardiology. So based on that, he connects to that specialist or to that doctor here in Nairobi, and the doctor can see the patient, can be able to talk to the patient, get more information and assess the patient. See, people die due to malaria in rural areas, which really doesn't make sense. We have the cure, but just because of the lack of that diagnosis that this person had malaria. So we have this rapid test strip whereby you just put a sample of blood, in a minute you get the results. And you can know that you should go for this medicine or for this test.
So you've equipped certain clinics and hospitals in rural areas with these types of kits?
Absolutely.
Okay, so how is it that someone in a rural area can know where to go in order to be able to connect with the doctor, say?
So basically we are linking up with like primary facility, healthcare facility, who don't have this access to the specialist, So there's, of course, you have to create the awareness that the patient needs to know, or that locale, that surrounding area needs to know that there's this particular clinic or a kiosk who's connecting to specialists with the help of IT through telemedicine. So like that, we've done several implementations here in Kenya. We've done, just a few months back, we are doing a pilot program. It's still going on in Thika, also in Embakasi, and also in Rongai. So they are not only connecting to like doctors here in Nairobi in Kenya, but they are connecting to doctors also in India on audio video mode. So we have a specialist in India who can consult with the patient here.
So in terms of technology, how connected does the patient have to be? Is it just that when they get to the hospital, that's when they'll be connected, or do they need a phone that is able to show them, like, this clinic is near me and has these facilities?
So for now, what we are doing is that this facility will be offered in a facility. So once the patient walks in and gets consulted by a clinical officer, for example, and if there is a need to refer this patient, then only the clinical officer or the doctor present there will initiate the call to that various doctor whom he needs help from.
Okay.
So for now, that is what we are doing, but in future we are planning to even have it with the patient itself, because see, a patient himself or herself cannot literally do all this, you know.
They need a
nurse. They need a nurse, they need a medic who can help them do that.
Okay.
Exactly. So at the primary level and the secondary level, you can be able to get treated via telemedicine.
Wow. You said including doctors in as far as India.
Absolutely, anywhere in the world, not only in India.
Okay.
Yes, we are approaching from Cuba, from Israel, from South Africa specialists.
Okay.
And all we just do is just give them the platform for telemedicine, and they can just log in wherever they are, and they can be able to consult with the patient.
Okay, I think it's important for me to ask whether there is a cost to your apps for anyone watching who's interested in trying this technology. What is the cost?
To the patient?
Yes.
Absolutely zero.
Okay.
You just have to download the app on your smartphone. It's available on Google Play and App Store. And then you register and you start using the app. Actually, it would interest you to know that it is helping the patient save money, because the ordering process is actually like a bidding process. You're floating your requirement for the drugs to the available pharmacies, so that they bid for your requirement for medication. So when they do so, they have to be competitive, and so they offer you the best price possible.
Oh, that's interesting.
Yeah, in fact, we had a case at Ahad where a patient needed medication for chronic conditions. There were anti-diabetic medication, antihypertensive medications, cholesterol-lowering medication, and the difference between the lowest quote and the highest quote was 6,000.
Wow.
And this is medication that the patient has to use every single day, I think, for a lifetime.
So you mentioned that you're referring patients to chemists just within a certain number of kilometers radius.
Yes.
So what if it's a drug that's absolutely not available in my area?
Libya has bulkhead support. So if none of the pharmacies in your vicinity has the drug, the support team will help you source for the medication outside your locality.
Okay.
Yes.
Okay, so how wide do you go in sourcing?
As wide as we can get the drug.
Okay.
Yes.
Okay, but for now you're just located within Kenya.
Yeah,
right?
For now we are
those
located
are your
within
boundaries.
Kenya.
Okay.
Yes.
I'm curious to know what the tech space is like in Kenya and how receptive it is that the average Kenyan is to going to Google Play Store or using technology to sort of take care of their health solutions, because we typically think traditionally go to the hospital if I have a health problem, or go to the pharmacy, do this myself. How have you found that Kenyans are responding to all this?
Well, initially, of course, there was a challenge that if I'm not touched by a doctor, I'm not cured, or I cannot be healed. And seeing a doctor through like the machine, like a laptop, and wherever the doctor is, that was this thing. But then they realized that it's better to have access to a doctor even through this platform rather than not have it at all. So right now the patient response towards this is positive. They're excited. As a matter of fact, now they just want to do telemedicine consultant and see the specialist in India, for example, you see. So this slowly with time, these things are changing. The mindset, the perception of the people is changing, and they're embracing technology. And within like 3 years from now, I believe everyone will be like on the same platform and embracing technology. As we've had this challenge, people don't adopt technology. Like say M-Pesa, for example, people were scared to even do a small transaction, but see now where M-Pesa is. Absolutely. And in healthcare, telemedicine is the future.
Okay.
Yeah.
I'll bring the same question of cost to you, because I mean to equip hospitals and clinics with this equipment cannot be cheap, in addition to the technology that you're using. So what is the cost to the patient who visits a hospital where these services are available?
Basically what happened is that we've tied up with these hospitals or these clinics. So we're providing them with this kit. Of course there is an associated cost with the kit, but what we try to do is try to engage a lot of different people on board who can fund this, so that even for a diagnosis to happen via telemedicine or a consultation per se, if a specialist is charging, let's say, like 5,000 shilling and at his clinic, and we have this platform telemedicine, it might charge half of that or even less than that. Absolutely. So the cost to the patient, even for using this, will be less than half.
Okay.
And most of these things which we have, this application is designed and developed by us. It's our product, it's our IP, you know. But these gadgets you're seeing here as a cost associated with it. So they may opt to get their own gadgets. We can give them like the details about it, you know, and the vendor name, and they can get it. So definitely there is a cost, but the cost the patient will bear will be not as much as the patient travel. Yeah, absolutely, because you see, you are minimizing patient travel.
Yeah.
They will travel from point A to point B, because he'll have that facility present already there at his or her place, you know. So you've saved their time, you've saved them money, and even what they'll pay for the consultation will be probably half of that. Yes.
In terms of reach around Kenya, how many counties or how far spread is this technology available?
So far we've implemented across 3 counties, but we're looking forward across all the 47, and our plan is to set up 1,000 clinics and 5,000 eventually in the next 3 to 5 years. But our first target is the first 1,000. So we are also targeting all the 47 counties, even the northern region. A lot of questions have been asked, how will you manage this, the connectivity and all that, but right now we have things called 3G and 4G, which really helps a lot, and the application itself is designed in such a way that it can work on the lowest bandwidth and it can connect on a low bandwidth.
So which counties are
so we've done here in Nairobi, in Kajiado, in Kiambu.
Okay. All right, good to know. Norman, coming back to you, you said you guys are 2 weeks young in terms of being live for people to download this on Google Play Store. The reception, again, for you, how do you feel that's been? Who have you been targeting, or who do you find is downloading this most? In terms of also when we talk about phone capabilities and having a smartphone, and you know, whether it's people here in Nairobi or watu mashinani, who have you seen sort of gravitate towards your app?
When you look at the statistics that we have, like 60% of pharmaceutical transactions actually happen in Nairobi. In those 2 weeks, we've managed to have about 3,000 users downloading the app, and we process approximately 30 orders every day. We already receive approximately 30 orders every day. There are those, of course, who are trying the app. They place an order, they get a best offer, and then they cancel. They say they don't need the medication anymore. This is expected at first. But for us, our thinking is it's a question of people knowing that such a facility exists. So once they know that it exists, then there's a lot of interest in downloading this. Because when you look at the convenience that the app offers, imagine it's at night, it's probably raining. Like yesterday in the evening, we had one patient who needed medication, and he was in Westlands, and he placed an order, and within less than 1 hour they had the medicine delivered to them. And yesterday it was well, there are some light showers in the evening. So when you know there's that convenience, then definitely you want to use the app. So our hard part is getting the right target people to know that the facility exists.
Okay. Yes. So in terms of when you were, if we could just go back to where we were ordering something, when it came to prescriptions, you said that you take a photo of the prescription that you have from the doctor and upload it. Are there possibilities for forgery there? Of someone just getting a fake prescription? Like, how do you verify that this is actually
a genuine prescription?
Right, and who's doing the verification? Is it the pharmacy? Is it you?
Yeah, you know, if someone wants to forge a prescription, they can do it and present it at the pharmacy. What we are doing is providing a platform which is essentially a digital counter. So we don't take away the responsibility of the pharmacist to verify the prescription. And the other thing we also do is, because there has to be a contact with the patient at some point when the delivery or the patient is taking the medication, you ask for the prescription, because there are those products that are controlled medications. So for that, the patient must give you a prescription, and you have to take the physical prescription.
Right.
Yes.
Probably someone might be watching who owns a pharmacy and they're not finding themselves on your list of pharmacies that are in their area.
Yes.
How does that work in terms of verifying which ones are legitimate and which ones? Because there's lots and lots of chemists all over the place.
So actually we've gotten a lot of interest, a lot of inquiries from pharmacies, but we want to work with legitimate pharmacies. So we go through a vetting process. Anyone can download the app, even yourself you can download the app, the pharmacy app, but we have to activate you, and for us to be able to activate you, you must give us the documents, the registration documents from the Pharmacy and Poisons Board, and then we verify with the board that sure you're registered with the board, then that's why we are able to activate you. So anyone who wants to get on board can download the app and upload the documents, and then we'll review the documents and activate them.
Go through the verification process.
Yeah, and this can happen anywhere in the country, actually even outside the country, because our plan is in the next 6 months to reach out to East Africa and then West Africa.
Okay.
Yes.
Fantastic. Karan, to people watching who are in those 3 counties where this technology is available, how can you encourage them to get out to the clinics and the hospitals and sort of experience this if they have not yet used technology when it comes to their healthcare?
Absolutely. Like in Thika, we've done implementation in town, in the CBD itself, in Boris Clinic, and also in Makongeni, which is a little bit further from the CBD in Thika. It's called Gawa Clinic, and both of them, they are using this to consult, and also in Embakasi we have Rema Clinic. They're using that to consult with the doctors, you see. So basically in all this clinic we have a clinical officer who's present, and the number of referrals depends on the cases they encounter on day-to-day basis, and based on that they will decide that today maybe there's a need to connect to a cardiologist or orthopedic, or an ENT specialist. So I just want to encourage that this thing works, and it's tried and it's tested, not only here in Kenya but also in India. We've done with the government of Andhra Pradesh, and it's very successful, and we just want to try to use the same model and implement here in Kenya. All we need is just support from different federations, different organizations regarding this technology. It's working, it's proven, and even when it comes to the devices, data transfer, when it comes to the video part of it, and when I get my prescription, and which is all automated, it's in real time. You don't really need to wait for like a long period of time. Yeah.
So for someone who wants more information, just quickly, because we're almost out of time here, where can they find that more information on telemedicine?
Basically they can just log into our website, daktarihealth.com.
daktarihealth.com.
Yes, Daktari Health.
All right, thank you very much. Norman, final comments from you to interest people in your app.
Yeah, I want to ask people to download the app. The whole process is free of charge. The registration is free. You have it so long as you have a smartphone and connectivity to internet, even at the lowest bandwidth. You can use the facility, and you can actually compare what you have been spending on your medication, especially those who are on chronic medication, and see how much saving you are able to achieve through this. Yeah, so and put the word out there to anyone else who would benefit from this, and we're actually going to be everywhere in the country in the next couple of days. So access to medication will be very easy for everyone, and not just medication, even beauty products that are sold through pharmacies, those personal care products.
Okay.
Yeah.
So we'll download the app. Sadly, we're out of time, so I have to wind this up. I'll download it myself because you know I love delivery. So anything that brings anything closer to me is a good thing. Two apps that are bringing healthcare closer to you. Definitely great innovations in technology happening right here in Kenya. Thank you both for making time for us here on Power Breakfast. We're going to check back in with Chef Ali and Willis Raburu. They're still on standby with some Ramadan specials. So let's check out some of the final products.